share now. Let's see. Nice. You see that okay, Melissa?
Looks, oh, nope, you're on presenter screen.
Look at that.
I know, right?
How's that?
Yes, perfect.
Recording and
Well, welcome those that are on right now. Again, my name is Jim Squires. I'm one of the physicians from Children's Hospital of Pittsburgh. I think we'll give people just a few minutes to join here, start in a couple minutes. Hopefully we should have about 20 plus participants, but want to give everyone enough time to kind of join up. It's great. Again, for those of you that are just joining, we're giving people just a couple minutes to join here to make sure that everyone has an opportunity to join. So we appreciate your patience. We'll be starting shortly. We want to be respectful of everyone's time. So. Okay, everybody. Well, it's kind of 5 past 5 here on the East Coast, and I know we're kind of all across the country, so 5 past whatever hour, wherever you are. But want to kind of welcome those, and I think others will probably be joining in as we get going here. Again, my name is Jim Squires. I'm one of the physicians here at the Children's Hospital of Pittsburgh. Very, very, very excited to have you all join us for this kind of first advisory board meeting for the partner PCORI research or kind of a project, I guess, right? So again, today I'm going to kind of start off with introductions to the partner project. We'll be kind of speaking on behalf of Melissa McQueen, who will be speaking here in a little bit. Liz Eisenberg, who's another one of our parent leads from Columbia. Emily Perito from UCSF, who's really been leading this effort. She's actually on a plane, but should be hopefully joining us shortly. She's on her first plane since the pandemic, and so she's excited about that. Dr. Mazaregas, who's joining us from Pittsburgh, as well as some of our other support staff. So kind of the agenda for today's meeting, I think we'll spend about the first 5 minutes just, again, kind of updating folks and introducing them again to partner, as well as kind of the project outline and the goals. I think then we'll spend a good period of time introducing ourselves to each other so that we understand who we are. I think then we'll have Melissa kind of lead a little bit of a discussion about, how we can optimize these meetings, how we make sure they're safe and productive and enjoyable, I think, for all of us as we look to join these. And then, kind of actually finish up with, kind of an introduction to getting started to how we will run this project through our collaborators at the Real-Time Clinic and get a sneak peek at the first module for the partner project. We'll then wrap up with some discussions, questions and comments, and hopefully get out everybody on time within the hour. And again, just before I start, I want to make a quick point that, I think we are recording this session for those who aren't able to join. So just to kind of make sure that people are aware that we are recording it. If you need to hop off or leave early or do things, we understand everybody's busy and has multiple balls in the air, so please feel free to if you need to step away for a moment, perfectly fine. So again, Partner is a collaboration between transplant families, which is led by Melissa McQueen, who's joining us today, waiting there, and can speak more to her incredible organization of 2,500 members from 40 transplant centers that are really lead advocates for patients and families and children who receive transplant. And the Starzl Network for Excellence in Pediatric Transplantation, which is a novel learning health network represented by the 10 centers of which each of you are a part of. And so, I think it is a collaboration and it is being funded by the PCORI Institute. And so for those who are not familiar, PCORI stands for the Patient-Centered Outcomes Research Institute. This is an independent nonprofit organization. It was authorized by Congress back in 2010, and it funds research that provides patients and their caregivers and clinicians with evidence-based information needed to make better informed healthcare decisions, which is hopefully what we plan to do in Partner. Kind of one of the core beliefs is that every step of research should be a collaborative process between providers, patient partners, and other stakeholders, and we've obviously worked to get that collaborative group together for our Partner Engagement Award. So what does it mean to be a Capacity Building Engagement Award, which is what Partner is awarded through? So this is an award that has received 2 years of funding. Kind of the focus of these awards are to build the knowledge and abilities of the community, and that's you, to be meaningful partners in the research process. And so that is kind of the core tenet of what these Capacity Engagement Awards do, and is what we will look to do together in the Partner project over the next 2 years. So again, this is kind of the goals of Partner, right? It's to help all members of the Starzl network and pediatric transplant community learn about patient-centered outcomes research. This concept of patient-centered outcomes research, it's sometimes novel to many people. And so I think what we want to do is help learn how best to do it and what it is, and then how best to do it. Along the way, we are looking to get feedback from really all of our stakeholders. That includes our physician partners, our allied health partners, our patient and family partners, as well as other stakeholders, because we want to make sure that we understand how best to optimize this concept of patient-centered outcomes research, with the end result being that together we can improve the lives of all pediatric transplant recipients. And that includes obviously those that you know and love. I think that the kind of core product that we look to achieve over these 2 years of funding is what we're calling the Patient-Centered Outcomes Research Roadmap. And we'll talk a little bit more about that, but at the end of these 2 years, we want to learn about patient-centered outcomes research, learn what is important to our community, and then design a roadmap that will allow us to do this type of research into the future to be able to address the concerns that are recognized as priorities amongst this group. And so kind of a quick kind of flow diagram of what we expect to do in Partner. So Partner is going to be a process by which we are going to create what we're calling educational modules. These are really being, at least the first one, initially drafted by our partner leads. And so these are the leads of the Partner project. Obviously, Melissa McQueen, Emily Perito from UCSF, myself, and Liz Eisenberg, who is one of our parent leads from Columbia. We also have an incredible group of support staff that are helping us. Dr. Mazaregas, who's our Chief of Transplant Surgery, is acting as the administrative official. That's the hat he wears for this project, as well as CJ Confair, who is our project coordinator. Once we draft these modules, this is really where you come in. And what we are looking for you and what your help in doing is recognizing that as we create these modules, we want to make sure that these modules are beneficial. And so we will use you as a sounding board to pilot these modules, get feedback, make sure that the material makes sense, that it's consumable for you as an advisory board member, and then we will take those that feedback, go back and revise the modules. Well, first, this is us, right? So we'll talk more about who the advisory board is in our introduction, but this is kind of our group. And so once we get your feedback, we're able to then distribute the module to our broader stakeholder community. This includes people from the Starzl Network, people from transplant families, SPLIT, which is the Society of Pediatric Liver Transplant, which is another research network that many of our centers are part of, as well as other stakeholders. The distribution of these modules will be through our partners at the Real-Time Clinic. Nehal Swami is our contact and kind of the lead person at the Real-Time Clinic. And so this is an app that we can all download on our phones and devices that we will use to be able to distribute the module content. And again, we'll kind of go over this towards the end of the meeting. Again, I think that once the module has been distributed, we will then kind of collate the responses and kind of come up with a summary. We will look to kind of get that feedback from the broader community. We plan to have additional focus groups, which is a separate set of individuals to kind of get additional kind of more focused feedback on how the module went. Did it make sense? Did it address issues? What things were brought up that they felt were important? We would also look to kind of some of our other partners to kind of, again, all along the way, get feedback on the information that's being distributed to everybody. We then look to kind of use these results to help draft, again, this roadmap that we will use to build what will be the kind of design of future research efforts that involve patient-centered outcomes. Again, once we get the kind of roadmap drafted, we will come back to you as the advisory board for, again, feedback and recommendations on, does this roadmap make sense? Does it kind of capture the feelings and vision and understanding of the broader group? We then take this to kind of the broader stakeholder community, which will kind of collate at our annual meeting where we kind of present the work to them for approval and ultimately lead to kind of, again, this roadmap that has, kind of these principles and project prioritizations and priorities that has been fed back from you, the community, all along the way. So again, this is us. This is the advisory board. Again, we looked to get a parent-patient from each of our 10 centers of the Starsville network, as well as a provider. We were very cognizant and wanted to be very careful to make sure that we got a wide variety of voices. So, whether it's physicians, social workers, extenders, nurse practitioners, physicians assistants, we wanted a broad variety of those folks. And so we were able to get one. And again, we appreciate you all for stepping up and looking to participate. And so I think, I want to take kind of the next 10 or 15, 20 minutes or so to really just go around the room. I think introduce ourselves, first name, last name, obviously what transplant center you're affiliated with. And then I think, if we could just kind of get one important thing that we should know about you and your connection to pediatric liver transplant. That's obviously what we're all very interested and invested in and what we want to improve the outcomes of. I would ask during this time, if you can, to turn on your cameras so that we can see you. If you can't, we totally understand. You may not want to be seen, and that's fine. But I will stop sharing my screen so that we can stop sharing. Am I stopped?
Yeah.
Okay, perfect. So again, I kind of introduced myself, but my name is Jim Squires. I'm a pediatric hepatologist who's here at the Children's Hospital of Pittsburgh. I'm one of the project leads. Obviously, my connection to transplant is it is my job. And it is a pleasure and a privilege and an honor to care for these children and families who have these diseases that lead to transplantation. And it's a passion that I love doing. And I couldn't be happier to do it. It's the most fulfilling thing I do, to get up in the day and get to come into work and take care of kids who have liver disease. So it's what I do. I'll turn it over to Melissa first, and then probably I kind of seize people's names, so I'm happy to call out, or if others, I think that's probably going to just to kind of keep it efficient. So maybe keep people's responses to about 1 to 2 minutes. Again, want to be respectful of everybody's time. But Melissa, why don't you take it?
Thanks so much, Jim, or Dr. Squires. So we've been working together quite a lot. So we all have been working for the last 4 months or so and know each other very well. So I'm going to be cognizant of the time. And my name is Melissa McQueen, Executive Director for Transplant Families. What brought me to transplant was my son, who was born with a congenital issue and had a transplant at 8 months old. Since then, myself and a lot of other like-minded parents formed Transplant Families, and we're so happy to be able to connect with you. I also want to say congratulations to all the parents that are here today. You obviously made it through the very stringent screening process. So we're so happy to have you with us, and I look forward to hearing all of your stories.
Perfect. I see Tony, Diana, Tony.
Yes, hi, I'm Diana Tony, and I'm a nurse coordinator at Children's Healthcare of Atlanta. And hi, Dawn. I'm honored to be here. And, my connection to transplant is that it's what I do, which I love. And I'm excited because I've done research in other clinical areas, but not in transplant. So I think this is such a wonderful learning opportunity, and I'm just thrilled to be here. So thank you.
Perfect. Thanks, Diana. Krista, I think you're next on my screen. So.
Hi, everybody. Thanks for the warm welcome. My name is Krista Van Roostel. I am a nurse practitioner at Sick Kids in Toronto, and I've been with the program for about 15, coming up on 16 years. So I am passionate, not only because it is also my job, but I really have enjoyed the unique position that I have, where I'm able to look after kids while they're waiting, kids while they're in hospital, after their transplant, and up until the time that they turn 18, where we transition our kids in Canada. So I feel very strongly about advocating for our families and patients as they're going through those multiple sort of milestones at all the levels. So super excited to be part of this, and thanks for welcoming me.
Thanks, Krista. George, you're up next.
Hi, everybody. George Mesregos. I'm very excited to be part of this. I think what's really exciting for me is this is really unique in pediatric transplantation, to have families and physicians and using maybe a novel technology like a real-time clinic learn from each other and to learn about what is important to families. And that increasingly, that's really become like a super passion of mine. And it's exciting to be working with all of the team here to get this PCORI grant for transplantation. We hope it'll help many children in many fields. And so it's just a super honor for me to be a part of it and learn from all of our parents and patients and providers in this process. So thank you.
Thanks, George. Kate?
Hi, I'm Kate Shaw. I'm an interim program manager with the Starzl Network. I'm covering for CJ Confair, who's currently out on maternity leave, but will be back next week. So it's great to meet you all.
Thanks, Kate. Yeah, I didn't mention Kate in the initial slide. She's been an amazing replacement for CJ while CJ's been out for maternity leave. So thanks, Kate. Hey, Liz, I think you're next.
Hey everyone, great to meet you. And to echo Melissa, thank you guys for all participating. We're super excited. So Liz Eisenberg, I am a representative at the Starzl Network, parent representative, patient family representative, and also on the executive steering committee of the Starzl Network. And my daughter had a liver transplant out of Colombia when she was 9 months old, and my sister is her living donor and saved her life. And so it's not lost on me every day, my gratitude towards modern medical science, doctors and surgeons, and my sister for saving my daughter's life. So I'm happy to be a part of this and give back, and super excited that we can all come together for this effort.
Thanks, Liz. Dawn.
Hi, everyone. I am Dawn Harrell. I'm excited to be here. I come to you by way of Children's Healthcare of Atlanta, a fabulous transplant team. My son was transplanted at 6 months of age. He is now 8 years old, and I have been vested in this since we first found out that he had biliary atresia. And so I also sit on the parent advisory board for CHOA. I'm passionate about this. I want to know more. Any way that we can help to, save lives, educate parents, educate the community, educate all stakeholders, and that part from, as a parent, what we experience, and translating that back to the doctors and nurses who care for our children. So I'm excited to be here and ready to do whatever we need to do to move this forward.
Don, thanks so much. We really appreciate you being here. Danica.
Hi, everyone. Nice to meet you all. Danica Chichester, but you can call me Danica.
No, I'll call you Danica. I will pronounce it correctly.
Parent representing Mount Sinai Hospital here in New York City. And what brought me to pediatric transplant is my daughter, 2-year-old daughter. She had a liver transplant about 2 weeks after her first birthday because she has a metabolic disorder. So she needed the liver to help her process enzymes to give her a more normal life. I'm excited to work with you guys. I know how important it is to work with your doctors and to have a good relationship with your doctors. As a parent, we want to be able to feel as though we could talk to our doctors about anything and feel respected by them. So, it's a better sharing process. So I'm excited to work with you guys. And hi, Claudia.
Thank you, Danica. I apologize for mispronouncing anybody's name. It's
No
entirely possible. So, Christina.
Hi there. So I'm here with my daughter, Sophia. Sophia had two transplants, first at a year and the second one at 3 years at UPMC. We are thrilled to be here to support this project. And right now we're in Chicago, but we were on the East Coast at the time of transplantation. So Sophia just graduated high school, getting ready to go to college, and is 18 years old.
Oh, congratulations. That's fantastic. Where's college? Where are we going?
I'm going to the University of Tennessee.
Oh, a volunteer. Good for you.
Yeah.
We need more volunteers, right? We're all volunteers.
Absolutely.
All right. Well, welcome. Claudia.
Hi, everyone. My name's Claudia. I am a social worker here at Mount Sinai, in New York City with the transplant team here. I love what I do. I just kind of stumbled into pediatric transplant 3 years ago, and I absolutely love it. I work with amazing physicians and nurses. My team here is wonderful, and I just am amazed by the patients and the families that I meet, like Danica and her beautiful daughter. And I just am so passionate about these families and patients that I work with and how resilient children are through liver transplant and what we're able to do with modern medicine. It never fails to amaze me. So I'm very excited to be here and to meet all of you.
Thank you, Claudia. Sharad, you're up next.
I am Sharad Wadhwani. I'm a hepatologist at the University of California, San Francisco. And so primarily do research and care for children undergoing liver transplant, and absolutely love it. So I'm very excited to be here.
Sharad, thanks. And I do see Emily, she might be on a plane or in a terminal. I don't know. There she is.
Hi guys, I'm so sorry for the funny location, but I'm Emily Prito. I'm a liver doc at UCSF. We're so excited to have everybody here today and get to work with you guys over the next 2 years. I'm keeping my camera off because we're kind of moving through the airport. I had a very, very badly timed flight, but my kids say hello.
Hey kids. Thanks, Emily. Okay, people are shuffling around, but I think Anna Gabriella, I think you're next.
Let's see. Can you guys hear me okay? Okay.
Yeah.
Hello, I'm a research coordinator at UCSF. I work alongside Dr. Wadhwani and Dr. Prito. I'm here just making sure the meeting runs smoothly, but I'm excited to see where this project goes and hopefully get to help in the future.
Well, thank you. So far, so good. It's running pretty smooth. So, okay, I think we have Jonathan. How do you say, is it Shizolna?
See if I could start my video while I'm en route. It is Jonathan Scholna. This is the first time Dr. Squires might be learning to say my last name, but I am the liver transplant social worker at Children's Hospital in Pittsburgh, and have been involved with the Starzl Network, help kind of get the patient and family voice group up and running and moving forward. And I'm looking forward to taking on this part of the journey. One thing that I just really enjoy is the opportunity to work and walk alongside our patients and our families in this incredible journey through kind of all the ups and downs and challenges that come with it, and to support you along the way. Just look forward to continuing that and giving back in a different way. So thanks.
Jonathan, thanks. Drive safe, man. I think Frank DePaula is up next. We can't hear Frank right now, so it looks like he tried to unmute. You can hear us, Frank. Oh, all right. Maybe we'll try. Frank, can you hear us? Frank, we're not hearing you very much, so we'll go next to Jin Lau and then maybe come back to Frank if we can get audio.
Hi everyone, my name is Jen Lau. I am a liver parent. My son had biliary atresia and transplanted at 10 months old back in 2012. So he's 8 years out now. And I'm also in Chicago. He's being seen at Lurie Children's. And in my spare time, I just dive into everything that I possibly can to help other families really just kind of understand this journey. And I'm really just looking forward to helping in any way that I can, and really am excited to see where this project goes. So thank you for having me.
Thanks, Jen. I think Becky?
Can you hear me?
Yes, ma'am.
Okay, hi, I'm Becky. I'm in Virginia and my daughter had a transplant when she was 2.5. I'm excited to be part of this program and to mostly learn from everyone else, but also to give some insight for the last 13 years that she's been out from a transplant.
Thanks so much, Becky. Well, I think Frank, we'll try you one more time, see if we can hear you. Crickets. Well, Frank, maybe, I can introduce Frank. I know Frank well. Frank DiBala, he's a transplant hepatologist who's in Virginia right now. By way of Cincinnati and Michigan, I can personally say he's a wonderful man who, is as passionate about liver transplant as the rest of us. Hopefully he'll be able to join and introduce himself to you. But Frank, we know you're there. I think hopefully you can hear us. Text me if there's anything that I can do for you. I think there's been some kind of people joined. Is there anybody that's joined that hasn't introduced themselves yet? There's been some shuffling around. No? Everyone's had a chance to introduce themselves? All right, perfect. So, sorry, I think you guys are seeing things pop up as I am, but I think in the effort of kind of moving things along, again, if folks need to come back and introduce themselves, please do. We definitely want to hear from you if we haven't already. But I think we'll move on. I'm going to reshare my screen here. I think it goes to that one. And I think next we're going to have Melissa just kind of lead the discussion about some of the guidelines for our group here.
Thanks so much, Dr. Squires. Thank you all. Thank you all for being here today and giving us your time. We know how precious it is. I'm just going to review some housekeeping here for all the meetings. And for those of you that have been involved in family advisory councils before, you'll recognize many of these of the tenets of patient and family-centered care. So we have, how can we make this the best possible environment for all of us? Our meetings are a safe place, and you should feel free to share. Everything in this meeting will be kept private unless it is explicitly said otherwise. So if we say you can share something, then you can share something. And you can always ask if you're unsure if you can share or not, and we'll be happy to answer your questions. We believe all partner members should be treated with dignity and respect. Your voice is very important. Try to contribute at least once a meeting with something small. You represent the voice of your community. So many didn't get chosen, so you get a seat there. You represent your own voice and that of so many others. Watch time speaking during meetings to encourage fellow partner members to have lots of time to speak. And if you have any problems with scheduling or meetings, we encourage you to bring it to leadership before meeting. Kind of stole those from other family advisory council groups, the patient affairs group, which I was a part of at one point in time. But yes, feel free to ask any of us questions. We're all here for each other. We can serve as each other's mentors or helpers in any way possible. We're all traveling this journey together and are happy to help. Those are the basics. Thanks so much, Dr. Squires. I'll turn it back to you.
Sure, thanks. Thanks, Melissa. So again, I think we'll have plenty of time at the end for any questions, comments, or concerns. But if anybody has anything they want to pipe up about, please feel free to now or whenever. Just unmute yourself. Okay, so again,
Jim, can I say one thing?
You absolutely can.
Again, yes. One other thing I would love to add into this that I was thinking about the introductions is that I would vote for us all to use first names regardless of what your either professional or personal role is during these meetings. Because I think it's really important that we're all, as Melissa said, equal members and contributing members of these. And although we bring different areas of expertise to this, they're all equally important. So I know it's not something we always do across family and provider lines, but I think using first names would be a really good way to remind ourselves that we are all on equal footing here.
Thanks, Dr. Perito. I agree.
Wait, no, you're supposed to say Emily.
That was my bad. That was my fault. No, I absolutely agree. Again, we recognize that sometimes it may feel awkward. I grew up in Texas. Everyone's ma'am and miss and sir, but I get slapped down up in the Northeast when I do that. So first names it is. I think that Emily, you'd kind of talked about kind of wanting to walk people through this. I'm happy to do it if you're en route or in a terminal and it's loud.
No, yes, you should do it. It's still loud here. I'm sorry.
No, not a problem. Again, want to kind of introduce the group here to how this is going to look, what the actual learning modules or how we'll get access to them and what they're going to mean. So again, the first thing that we'll ask folks to do, and you can do that now or you can do it in the near future, but I think as soon as the meeting's over would be great, is if you go to your app store on whatever device you may use and type in real-time clinic. You can just do it all one word, real-time clinic. You'll see this app, and these slides will be distributed afterwards, right? So for those of you that are driving, don't try to screen capture or do anything right now. I think that if you download the real-time clinic app, what we will have you do is create an account. It's fairly simple. We've all done it from a leadership standpoint, but just some screenshots to kind of show you. So you download the app, you create an account. You then hit register now. You can complete the sign-up process either as a caregiver or a clinician. Obviously, if you're a physician or a physician extender or part of the healthcare team, you would be a caregiver, or sorry, you'd be a clinician. If you're a caregiver, like a parent or patient, you would sign up under that. Again, for the patients out there or those parents who have patients that are 18 years or older, they are welcome to sign up. As of right now, we're kind of limiting it to 18 and up for a variety of different reasons, but that's how we'll keep it for now. Again, you can choose to sign up with your email address or a mobile phone number. Either is okay. The only real reason that we need you to kind of have a phone number or an email address specifically is so that we can give you your money, which we talk about a little bit at the end, right? But as a participant of the advisory board and as a participant in taking surveys, a lot of the funding that PCORI gives is to recognize the importance of people's time and compensate them for that. And so when you enter that way we'll be able to kind of get you your information. This doesn't, we're not going to be emailing you crazy stuff. There aren't going to be any ads. We're not going to be calling your phone in the middle of the night. But we will need that point of contact to sign you up. So, this is what we kind of plan to do, right? These are learning feedback modules. Again, going back to the ultimate goal of this is to educate ourselves and each other about how to do this type of research. And then once we understand a little bit about it and how to do it, how we can harness it to advance the field of pediatric liver transplant. That's really what we want to do. And so we have designed a series of, we are in the process of designing, and will over the next 2 years, 6 total modules, approximately every 3 months over the next 2 years. Again, who are we pushing this out to? We're pushing it out to parents or guardians of pediatric liver transplant recipients or recipients who are now greater than or equal to 18 years of age. Currently we're in the process of maybe trying to lower it a little bit to teenagers and getting a Spanish language version. Those are in process right now and aren't ready for prime time just yet, but hopefully we'll be able to have those sooner than later. We expect each module to take about 20 to 30 minutes to complete. About 10 to 15 minutes of it's going to be actually going through the module and getting the education and doing the reading and watching the videos that will be part of the module. And about 10 to 15 minutes of it will be, again, this feedback survey that we very much want everyone to complete so that we can understand and kind of tailor and improve along the way. This is very much an iterative cycle of hearing feedback and then improving for the next round of the cycle. Again, module invites initially will go to the Starzl centers, and then there's kind of a series of broader communities that we will look to expand to in order to kind of make sure that we get enough voices and enough information back from these surveys. As noted, there will be for each survey a $30 gift card for the first 120 family participants in each cycle. There is no limit to the number of participants as we kind of increase the kind of circles of participation, but there's only funding for the first 120. But again, we will kind of start with Starzl and expand out to kind of make sure that we're capturing the voices of kind of the 10 main participating centers. I think not on this slide is recognizing the importance, and this is more for you guys, the advisory board, to understand. We're also trying to obviously look for the same participants, right, to do each of the 6 cycles. Ideally, it's not, it's somebody that does all 6 and not somebody who just does 1 or just does number 4 or kind of a little bit of a piecemeal. We're hoping that everybody kind of goes through the entire process and journey with us together. It's not going to be perfect, but that's the ultimate goal. This is just some screenshots of what the module will look like, again, kind of on your tablet or cell phone device. There will also be a desktop version of this as well, but right now, the first versions that will be coming out will be on the phones or the tablets. And again, I think you can see, the way this is, this first module is a little bit heavy in word content. Future modules will be heavier in video content and then combinations of them both. But what this does is, we're using content from PCORI to educate families, particularly in this module 1, as to what is PCORI, what is partner, how do we do PCOR research, how do we learn about PCOR, and then how can we use that to kind of accomplish the objectives that we care about, which is pediatric liver transplant. We're still working to. Oh, was there a comment? Perfect. We're still looking to ultimately finalize a little bit of the last minute language of this, so it's not live yet, but we hope by the end of this month it will be live, and we will distribute it to you all. This is what the survey then will kind of look like. Again, at the end of the module, you will have a series of questions. These are very kind of open-ended questions. There are no right or wrong answers, but we are trying to kind of gather information as to how we are doing and how we could understand doing PCOR research within our community. Some of them will be kind of multiple choice, some of them will be ranking, some of them will be kind of fill in with your own words. And then again, we get that information back as we did in that flow diagram, collate it, and then distribute it to various participants, including you, for understanding and building of that roadmap as we go forward. And then again, this slide mainly to point out, that we want to make sure that, as you wrap up, you provide that email or cell phone number so that we can pay participants for the participation in the survey. Any questions about that right now? Perfect. I see Frank DePaul has joined. I just want to take a moment to let Frank introduce himself with.
Jim, I'm
Hey,
so
man.
sorry about my audio before.
It's pretty embarrassing.
But let me not take too much time. I just wanted to say thank you for inviting us at Virginia to be a part of this group. My name's Frank DePaul. I'm a transplant hepatologist at UVA, and I'm really excited to be a part of this. I'm most excited to hear from patients and families and to learn from them. So again, thank you so much for having us.
Thanks, Frank. I appreciate you getting on. And so again, that's essentially the process right now, right? So we've actually been very efficient in our time on this first advisory call. Again, I want to make sure that we'll have an open discussion here about kind of make sure that everyone's understanding of the asks and of how things will look. But want to just take a brief moment to again thank folks for joining today and taking their time. As noted, as part of the advisory board, there is additional compensation for taking your time to do this. And so each advisory board meeting, there will be a $60 gift card that will be sent as an email. And I think we have all of your emails because, again, we've communicated for the advisory board issues. That gift card will come as soon as possible. We're still working on channeling funds from PCORI to us, but once we get it and have it in the account, we'll be able to forward that to you as soon as possible. I want to just make sure that people know of this email, partner@starzlnetwork.org. That is kind of a general email that is viewed mostly by CJ here at the Starzl Network. So any questions or concerns, I think this is a great place to post that question, and CJ will know how to find the answer that's ultimately needed. You can always go to the Starzl Network /partner a website to learn information about partner. And as we noted, module 1 will be coming very soon. I think next couple of weeks we'll hopefully to have that live. And then I think as we go forward, we'll be obviously again really leaning and looking to you on the advisory board to let us know and give that very honest, unfiltered feedback about how we can do, how we are doing, how this is looking, so that we can optimize it and really fine tune it before we kind of distribute this more broadly. And then on the back end, once information starts coming and rolling back in, you guys will be key in helping us build and solidify that roadmap to move the whole process forward. So I think I will stop now. I think those were all the slides that I had. Any questions, comments, concerns? Things that people would want to discuss more broadly?
Hey, I had a small logistical question. I downloaded the app while we were meeting, and there's a question when you register that asks if you're part of the PELT QL project team.
Yeah, so no, we're there should be a partner option in that. So PELT QL is a different project that's being run. Thank you.
Thank you.
Oh, for sure. Any other questions, comments? Emily, I know you're in road. Am I missing anything? Did we cover everything?
No, I think, we did a lot more talking during this meeting than we're hoping to do in future advisory board meetings. We're really hoping for this to be an open discussion where people can share their ideas and opinions. And then, if there's something you're not comfortable saying during the call, you're always welcome to email either any of us directly or the partner email. And we're happy to, either talk by email or set up another time to talk as well. We really want to make sure we're hearing people's voices in this. So we look forward to really more discussion in the future meetings. This was a lot of information sharing today. One other quick question for folks is just if this time is okay for people. These meetings will happen about every 3 months, and we were trying to pick a time that works across time zones, although we recognize that it's hard for folks. And we, again, really appreciate your time, and also are recording these meetings in case there's one that you miss.
No, it works.
All right. So again, I think in the future, these meetings, obviously the anticipation will be, we'll have information to talk about, it won't just be join and we're feeding you information. It'll be, you'll have had the experience of seeing the module or drafts thereof. So we can kind of talk more about them, or we'll be able to kind of go through them together and present them a little bit more as an open discussion. I think, as Melissa had mentioned before, again, we really want to hear from you all during these meetings. And so, sometimes it's awkward to speak up and speak out, and you feel like you're what you have to say maybe isn't that important. But we really would encourage everybody to try to come and voice their opinions, so that we are hearing from kind of all the different voices from all the institutions. Again, I think this was something that you each have a very unique perspective and a unique experience that we want to incorporate all of those different voices into this moving forward, and not have it just be a few choice voices from a few centers. We want to really encourage everybody to speak up and speak out. Well, okay. That being said, right? Again, I want to respect everyone's time. It's nearing 6 o'clock here on the East Coast, and so I think again, questions, concerns, please send an email. You're happy to reach out to any of us. We'll obviously be in communication with you with your money, hopefully soon, and definitely once the project is live. I think if everybody could go ahead and download the Real-Time Clinic app, I think that'd be the next kind of concrete steps. You can kind of get a sense of how that works and what that flow is. And we'll be talking to you guys very shortly.
Awesome.
All right, guys. Can't thank you enough for volunteering. It was great meeting and seeing everybody. We'll see you soon.
Thank you.
Thank
Take
you.
care, everyone.
Bye.
Thank you. Bye.
Thank you.
Thanks, guys.